Hey, good morning. Happy Friday, everybody. Look, we're here to talk about the Franklin Classic, but I got to give a shout out. Look, I have this. This is what I got this morning when I went by Trader Joe's. It's now open in Franklin at 545 Cold Springs Boulevard. There's a pretty good line this morning. Look, the ladies are excited here. We're getting ready to talk to them. So go by. Here's my tip of the day because, everybody talks about the Trader Joe's wine. So let me tell you how to get there first, okay? Walk into the store, go all the way to the left along the wall, and that's your whole wine section. It is completely stocked at this point.
Okay.
Great.
But let's shift gears and talk about the Franklin Classic. I've got Dottie and Cindy here. So that's coming up in just 2 weeks? We've got 2 weeks left?
Yes, coming up in 2 weeks, September 6th. On Labor Day.
I love this event. It's always fun. Get up early on Labor Day. You should be one of those people that gets up early on a holiday, get your little workout in, your little run in, and then start your day, right? Then it doesn't matter. The calories don't count the rest of the day.
That's right. They won't. They won't at all. We joke with Dottie around here, Donna, because I'm an early bird anyway. I get up early. But on the day of the Classic, Dottie doesn't go to bed the night before. So ever.
Well, that's usually because I'm busy. But before actually being a part of facilitating that event, I would also help the young lady that was in charge of it before, and I would just get so pumped about it. And then adrenaline is going, you can't sleep. Plus, there's so much to do the night before that you just don't have enough time to do it. So
yeah, let's talk about that. It takes place in downtown Franklin. If you ever wanted to run the streets of downtown Franklin, here's your chance. You get to run down Main Street. That finish line is right on Main Street, which I love. And where else are you going to be able to do that? You might be able to run the sidewalk early in the morning, but this time you just get to run right down the middle of Main Street.
That's right. And even if you're not a runner, if you and your family would just want to walk the 5K, it's a lot of fun.
Or if you just want to cheer the runners on.
Yes.
We have in the last few years had the streets of Main Street just lined with families cheering their friends and other family members, or just being there to be a part of it, cheering them on. And we've had several thousand people line the street doing that. So much fun.
There's actually a lot of function going on while other folks are running. We've got a kids zone with a putt-putt course this year, and several vendors that will be around the square. Thank you.
And there's always music, and there's always some food you can get, and it is a great time. You're right. Thanks for bringing that up. You don't have to run. You don't have to walk. You can just be there to cheer on everyone else. And you could donate, because let's talk about this. This is a fundraiser for Mercy Community Healthcare. Let's talk about that.
Well, I'll start and then let Dottie go. Mercy Community Healthcare is the same that it's been since it was Mercy Children's Clinic, except that we've grown. That's our mission is the same, to reflect the love and compassion of Jesus Christ by providing excellent health care to all. And that has not changed, even though we've grown larger. Last year in 2020, we saw over 11,000 people with over 53,000 visits. So our service is from primary care for pediatrics, for children, all the way to adults. We cradle to grave, we see anyone. And we have an extensive behavioral health care program now, with psychiatry and with behavioral health counseling, and a variety of services with that. So yes, it is our largest fundraiser. It's funding that we need to care for people in this community and in our service area. And we love it, and we're grateful to be able to share that with the community on that day.
Yes, let's talk about what did it look like for you guys servicing the community in 2020 during COVID? What was that like for you?
Wow. Well, we're part of the public health service, so we're an essential service. We are not going to close ever. As a matter of fact, when there's a crisis, we work really hard with our sister, the health department, to service as many people as we can. And so we stayed open, and we did. we're smaller. We don't compare to what Kathy Montgomery and the Williamson County Health Department did, but we tried to be a backup. And we saw thousands of people giving them tests. And then when COVID came full circle, we've been giving vaccinations. We had months of vaccination clinics on Saturdays. And then we moved to morning. Every morning we had vaccination clinic. And now we're 2 days a week. We have been bombarded the last 2 weeks with the variant. And we're taking care of folks and open to serve, and looking at that line and hoping it's going to start going back down as folks get vaccinated and take care of themselves.
Right.
Yeah, we actually administered over 2,000 tests last year in 2020, 2,000 to 3,000 tests. And this year we have already administered over 3,000 vaccines for COVID. And so we thank God for telehealth. Mm-hmm. We were able to provide telehealth services, especially for our counseling and psychiatry. And that really kept us afloat because some of the families were afraid to come in for their services. And so we were able to provide the service through telehealth. And that worked well for our families and for Mercy.
Actually, Donna, that's true, Dottie. Thank you. And we need to give a shout out, not just giving God the glory for what we've been able to do and help, but we had some church partners that really, at one point we were in a room trying to figure out how do we help? What's the best thing for us to do? And this was back in March, actually, of 2020. And the expense of the license to provide telehealth was something we'd never had. We'd never done that. And it was exorbitant for us. And in that same day, I got a call from one of the larger churches in town that said, we know you're hurting. We know you need to serve people. What can we do? Not only and they actually helped us purchase those licenses, but not only did that happen, but as our providers and our nurses hitting the front lines with PPE on, folks all over town brought us lunch, tried to take care and do the best that they could do to support our healthcare heroes. We've got an amazing staff here, and they've done a wonderful job through 2020 and are still working it right now.
Yes, and our donors and other supporters stepped up. Yeah. As I said, the churches helped immensely, but we also had donors who prayed for us, who offered donations and brought donations to help us. And so it was truly a community effort in helping Mercy to serve the community and provide the services that are needed in the community. Yeah. And we're very grateful for that.
Yeah, I know that we've talked about this, and I've talked to you guys for many years, and I understand what you guys do. But for people, I keep forgetting, there's so many people who move here every day. So let's quickly talk about what Mercy Community Healthcare does. You offer healthcare services to anyone, regardless of ability to pay. Is that still the case there?
Go ahead. Yes, it is the case. Mercy driving force is integrated healthcare for all and their families, body, mind, and spirit. And so what does that mean for Mercy in terms of our services? It means that if you come in for primary care and you need services for counseling or psychiatry or social determinants of health needs, we can help you that very day that you're here. You don't have to leave the clinic, the medical center, without receiving those services. And so Mercy provides primary integrated mental health services. You can get primary care, pediatric, and adult care, primary care. You can also receive our mental health services, which include counseling and psychiatry. And we also have a family service department, patient and family service department that help families with referral services to subspecialists, chronic care management services, and we can provide you with help if you need help with paying your rent, your utilities are about to be disconnected, we can help with those. So many other things that prevent families from coming in for health care. We can help with those things so that they can be about the business of focusing on their health and better health outcomes. So Mercy is here. We also have a school health service program, school counseling program. We're in several schools in 22 schools in Marshall County School District, Williamson County School District, and Franklin Special School District. And we're being asked every day to come to more school districts, but we need more resources to do that. But those are the service that we do. And as Cindy said earlier, that Mercy's mission is to reflect the loving compassion of Jesus Christ as we provide excellent health care to all and support to their families. And that is what we do, body, mind, and spirit. So we're here to serve, and those are the services that we do. And we do our best to be the hand and feet of Jesus every day as we provide that care.
I would say the mental health care portion was probably really important last year.
Yes.
I'm sure you saw an increase in requests for that.
Absolutely. Yes. Yeah, we have a part-time psychiatrist and 4.5 psychiatric nurse practitioners. And at this point, we have a waiting list, which I'm not proud of. We want to not have a waiting list. There's just a dire need in our community, and we all know that. We actually were at a meeting with Faith-Based Alliance earlier this week, and Chief Faulkner gave a very compelling presentation about the suicide rate that we're experiencing in this community. So we want to be there. We want people to know that we're here to help. And yes, mental health increased significantly in the last 2 years.
Even more reason why you should come to the Franklin Classic, whether, like we said, you run, walk, or just participate and be a cheerleader, but you can still donate. So tell everybody how they can take part in the Franklin Classic.
Well, we do have a Franklin Classic webpage, or you can go to mercytn.org and sign up there, register, or donate for the Franklin Classic. We have right now a little over 1,100 runners registered for the race. And we have spirit runners where you sign up. It's $25 and you will get a t-shirt. And that is just in spirit and in prayer. You're praying for this event and cheering us on. And so we still have room for more runners. We still have room for more spirit runners. And we definitely have room for more donations. Mercy has to raise approximately $1 million or more a year to provide the services that we provide to our community that have no insurance or those that are underinsured. And so we offer a sliding fee scale, but we have to have those dollars that are donated to us to make up the difference between what a patient pays using the sliding fee scale and the total cost of those services. So we need your support, we need your help, and we're so grateful for all that you do for us in helping us meet the needs.
Yeah, so this is taking place Labor Day, which is, I'm just looking at my calendar, September 6th, is that right?
Yes.
Yes.
Monday. Yes.
Monday, September 6th. It starts at what time?
Well, we're there as early as 5 in the morning, and the actual first race starts at 7. I think 7.
I'm about to tell you, because we've gone back and forth about how to start.
Right.
The first race is at 7, and that's the 10K.
Right.
8:30 is the 5K, and then at 9:30 there's a 1K for all the kids.
Yes.
Which is fun because it's just a very short little loop around downtown, and it's so fun to watch them run. My kids did that when they were younger, and it was really fun. Yeah. I wanted to go with them, but they were like, no, I can do this. I can do this. It's kind of hard to let them go, but they did it.
And it's the cutest thing because so many of the children actually practice year round for this 1K because they want to win.
Exactly. And there are prizes. You offer prizes.
Yes.
We have
Just to let
prizes,
everybody
yes.
know.
You did
We-
mention music too, Donna, and we wanted to make sure that we shared the band that plays and has for the last couple of years is the School of Rock.
Yes.
So they come and we get to hear all this new talent, and they're
Yes.
awesome. They're
Yeah.
really good.
Homegrown.
Yes.
Yes, I love those guys. They're always do a great show. I think they just did a show like last year or well, the last previous time when we had live music. I think it was at the Ryman was one of their last shows.
Oh wow.
Yeah. Yeah.
All right, well, you guys go check it out. It is a great time. It is fun. It is something to do. Get your family out on Labor Day. Then you can go home and do your cookout. Get out early, like I said, burn some energy and support a great cause.
Yes.
All right, give us the website one more time so people can check it out.
It is www.mercytn.org. And there is a place there for you to register for the Franklin Classic as well as donate.
And tonight, I should mention this. You're going to be working at the Great Americana Barbecue Festival. We talked about that the other day. You're helping tonight serve, right?
Yes.
We are. We
Yeah.
are so excited.
We're
Our leadership team is going to be there, and we're going to try to pretend we're waiters. So.
Yes. Yes. And I've been practicing.
Yeah.
I've been
Okay.
practicing.
Okay.
Yeah, the Mercy's entire leadership team will be there serving as servers and bussers for the VIP dinner tonight of the sponsors and others who will be attending that dinner. And so we're really pumped about that. Yeah.
So if you want to meet these ladies, buy your ticket because I heard there's a couple tickets left to the VIP dinner tonight, Harlow and Steel Farm in Franklin. It's going to be great outside. So nice. Watch the moon. We have a full moon right now, don't we? Or close to it.
Yes.
Yes.
All right. Thanks again, you guys. We will see you soon. Bye, everybody.
Thanks, Donna.
Thank
Thanks
you, Donna.
so much.
Thank you. And thank you out there for your support.